The American College of Cardiology sessions happen in Washington, D.C. this weekend. This large meeting brought researchers from all over the world together for the first in-person large cardiology meeting in 2 years. Our 9 Health expert, Dr. Payal Kohli, went. She chose some scientific tidbits to cover for us this morning. Good morning.
Good morning.
Thanks for coming in.
Such an exciting meeting, Corey. So much great science.
So we're going through kind of 4 new studies. The first one's really interesting. So what does your voice reveal about your heart risk?
Well, it seems like we're not studying patients as comprehensively as we should. So they used, researchers from the Mayo Clinic used an artificial intelligence algorithm to look at the pitch, the cadence, the amplitude, 80 different factors in your voice and give you a voice score. And if you ended up having a high voice score, you were more likely to end up in the hospital with chest pain and more likely to have a heart attack. So it's almost a biomarker, so to speak, of what might be happening inside.
So is it like if you have a really deep voice, or high voice, that depends on your heart risk?
Yeah, so it's hard to say one specific factor because it's a conglomerate of all of these different factors into the scoring system. But yes, the intonation, the inflection, the volume, the pitch, the speed at which you're talking, all of that determines your heart attack risk. And you can sort of see that, right? Because our voice changes based on how excited we are, how stressed we are, how depressed we are. So I think it's just a very interesting, thought-provoking study.
Yeah, I wouldn't want to know what my voice is about my heart. I have a feeling it wouldn't be good. Wearable devices and smartwatches are really popular. Do they work equally well for everyone?
No, and this was a surprise. So the way that a smartwatch tells your heart rate and all of those other things is by using light. It shines light through your skin and looks at the blood vessels under the skin, essentially, to know what your heart rate is. Now, if you're a darker-skinned individual, those measurements are not as accurate.
Really?
Yes, because the algorithms were designed entirely on Caucasian skin. So it really begs the question, should we be including more races and designing race-specific smartwatches?
Well, that seemed like a no-brainer that they would do that in the testing phase to make sure that it works for everyone.
Surprise, right?
Yes, it is.
Yeah.
Okay, I'm learning a lot. Okay, really interesting. Noise around us can play a part in how healthy we are and how our heart's doing.
Yes, we always think about risk factors that we can control. We don't think as much about our environment. But this large study from New Jersey showed us that noise pollution, which is excess noise in our environment, can actually affect our health. And what it said is that your risk of heart attack is 72% higher if you live in a noisy neighborhood as compared to a quiet neighborhood with trains or buses or cars or
babies. Do babies count? Tell my
neighborhood kids screaming outside. Yes.
Oh my God.
Yeah, and in fact, 1 out of 20 heart attacks in New Jersey they attributed to noise pollution.
Really?
Yes.
So it's
indeed.
beneficial to get out of the noise. Okay.
It is, and to start to be more mindful, I think, of the noise around you as well, and try to minimize it as much as possible. Of course, it's hard to move where you live, but
put my kids in their room, shut the door. It's good for my health. So we all know that exercise is really good for us, but there is some research that exercise may be better for those with depression and anxiety.
Yes,
Why?
so we should all exercise, but when we have depression and anxiety, in some ways, the benefits we get from exercise, the chemicals that are released and the effects that they have on our heart are twice as good. So your risk reduction with exercise as a regular person, about 10%. With depression and anxiety, 22%.
Wow, more than double.
Yes, and it's not just any little bit of exercise. So I want to be clear that this is 30 minutes, 5 days a week of moderate intensity exercise. So getting that heart rate up is really, really good for
That was all
everything.
fascinating. All right, Dr. Kohli, as always, thanks for coming in.